This is Dr. Valerie Walker, and here we come to you today with another powerful episode of the Medical Moment. Today we're going to talk about a subject that a lot of people don't want to talk about because they find it embarrassing. And that's what we're going to do here on these shows. We're going to dispel myths, we're going to bring the truth forward, and we're going to talk about those things that you don't want to talk about. So today's show is going to be on erectile dysfunction, and the name of this show is Sugar Daddy and Big Mama. Now, before we begin, let's just talk a little bit about erectile dysfunction. Erectile dysfunction is the continuous inability of a man to either obtain or sustain an erection. It's a very common problem in America, and the NIH, which stands for, and remember this because we'll use this a lot, NIH stands for the National Institutes of Health, estimate over 33 million American men may suffer from erectile dysfunction, or to put it short, we call it ED. Frankly, I think it's more than that because men a lot of times don't like to talk about their health. If you go in the waiting room, usually there's a lot of ladies in the waiting room and a few men, and the poor little few men that are there are sitting off in the corner somewhere trying to hide being in the doctor's office. So we're going to talk to the men and the ladies today. Before we get into what causes erectile dysfunction, and better still, I'm always going to give you tips on what you can do about it. Let's just talk about setting the mood first for you couples that are married for the bedroom. Now, the first thing you want to do when you go to the bedroom and you want to create this ambience, so we're going to know that this is not a factor in erectile dysfunction. Ladies, let's start with you first. Do you hear me? Do not go to bed with those big pink hair rollers in your hair, your big pink robe on, and face cream all over your face where nothing is showing but your eyes. And even if your eyes, all we see is those 2 to 3 inch eyelashes. So there you go, laying up in the bed with the eyelashes on, the face cream, the pink rollers, and the pink robe, and batting your eyes at your mate, and they looking over there at you like you looking like doggone it, I'll bite you. Well, let's just have a Dr. Phil moment. I love Dr. Phil. I love Robin. And what he usually does on his show is try to get you in check with how you really feel and what's really driving what's wrong with you. And then he tells you what to do about it. Well, that's what we're going to do today. When you look at your husband and bat your eyes with those eyelashes and face cream, and he said, doggone it, I'll bite you, then you got your feelings hurt. So Dr. Phil will tell you, tell your husband how you feel. Oh, I feel so bad when you call me. Doggone it, I'll bite you. And then you're going to tell the husband, look at your wife and see, is that the way you want her to feel? And those are the Philly parts of just getting to the root of why you looking like you looking. So men, I'm not done yet. Let's talk about you. Why are you standing at the bed, the foot of the bed, with your boxer shorts, an old boxer shorts on that you've had for years and years and years? Your socks are down by your ankles, talking about some big daddy coming at you. Come on now, big daddy. We got to do a little better than that. We got to spruce it up a little bit. Go change those boxes, and for sure, take those socks off, because that is just no way to get anybody in the mood for anything. So, ladies, the best thing that men like, guess what studies show men like the best? Black lace, followed by red negligees. So, your black lace, you don't want to come out in no shoes like these. And we don't, come on ladies, that is not going to cut it. You want to do a little variety a lot of times. Some of mine I pulled out my wardrobe. If you want to feel a little like a leopard and you want to feel daring, pull out some stilettos. Men love to see ladies in stilettos. Research has shown that, believe it or not. So pull out your best stilettos and put those on and do a little variety. Because black is the #1 color they love, followed by red. If you got some red stilettos, pull them out with the red negligee. I'm just trying to tell you ladies how to dress for success in the bedroom. And then you want to do a little variety sometimes. Don't always come out so fancy. And if you notice, all the shoes I've shown you have ankle straps. Men love to see ladies in ankle strap shoes. You can go neutral. That's okay with me too. It's neutral. And Another color, my favorite color is pink. I love pink. So I got my pink lace-ups, and I can wear those back in the day. Not now, but back in the day, okay? And then the other color that you want to do is, before I show you my number one color, is do a little variety. Look at those. Those are purple and pink. And everybody knows, again, my favorite color is pink. And I always want to try to get that ankle strap in there because that's very important. But the biggest color that you always want to keep, ladies, like to keep the little black dress, you want to keep the black stilettos. So if you coming out in your black negligee, you got to have your black stilettos and not these. Compare the two. Come on, ladies. Now, which one you think the men gonna pick? Wahoo! Okay, you got it right. Okay, so now you're all dressed for success. Everybody's looking good. The men have taken off those old boxes. You took the rollers down. You washed the cream off your face. We won't have to call Dr. Phil to interfere and tell you all what you need to do. Let's talk about what exactly is erectile dysfunction. We may have to do this show in 2 parts because it's kind of long and it's deep, and we have to keep these videos right at about 10 minutes. But let me just tell you again, erectile dysfunction is the inability of a male to maintain or even achieve an erection sufficient for intercourse. There are many, many reasons for this. The number one reason is that it gets worse as we get older. As men age, erectile dysfunction gets worse. Now, they used to say it starts in the 40s, but guess what? In my patient population, I'm seeing it even younger because young people eat so much junk food. And you're going to see what junk food has to do with high blood pressure, obesity, and heart disease, and how it relates back to erectile dysfunction. So as we age, a man ages, it gets worse. Another thing that happens is if a man smokes. Smoking hurts the blood vessels in the body. And the one thing I want you to remember, if you don't take anything away from this presentation, is that erectile dysfunction is worse with anything that affects blood flow in your body, meaning your blood vessels or your nerves. That's why people who have traumatic nerve injuries to their spine or something can have problems with erectile dysfunction. The penis has 2 chambers in it. And what they're responsible for is filling up with blood during an erection. So it's almost like blowing the air into a balloon, how you blow and blow and blow till the balloon gets stiff. Well, this blood has to come through these chambers for an erection to occur. So anything that interferes with blood flow, like heart disease, we've established a link between heart disease and erectile dysfunction, anything that interferes with the nerve supply to the penis will cause you to have erectile dysfunction. There are a lot of things you can do to make this better. Sometimes we can make it almost go away, but we estimate there are over 30 million, like I said before, men suffering erectile dysfunction. When we come back for part 2 of the show, we're going to talk about what are the lifestyle things that you're doing that can contribute to erectile dysfunction, and what are the things that you can do about it. And you're going to say you heard it all right here with Dr. Walker on The Medical Moment. We're coming right back with part 2.